Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Welcome to the Medical Collective, everybody. I am Dr. Keisha Davis, your host, and I have my amazing co-host and a special guest that you will meet in a minute. We have a lot to talk about, but we're going to get started with a couple of updates. Dr. Sharon, Dr. Tusa, how are you two?
Doing well. Thank you. It's great to be back with the Medical Collective.
Yes, it is. It's been a minute. We took a hiatus, everybody, since Christmas. This is our 10th episode now for the new year. Dr. Sharon, how are you?
I'm doing great.
Great. Well, there's a lot going on, and we know that. We will address it. But today, this month is Black History Month, so we're going to be celebrating that. But before then, there's been a little bit of updates we need to talk about. And hi to our Facebook audience. You guys can chime in if you have anything. If you have questions, put them in a chat. You too, do the same. And share. Okay, first and foremost, we've been talking about the bird flu or avian influenza. So the most newest update is that there is a strain, the strain that was in the flocks of birds and the strain that caused the sickness in the individual in Canada that got very sick, and then the individual in Louisiana that passed away. That strain now is in dairy cattle. So the USDA has been ramping up testing, and they found now that there is several herds that are infected by the strain that's more serious. So we've got to be looking out for that. I know that we're having suppression of information, but we've got you, Dr. Sharon, we've got Dr. Tusa and other doctors that are trying to share it. But be aware that there is now this strain that's infecting the dairy cattle that can be more serious. Any thoughts?
Yeah. One thing is that because of the suppression of the information, a lot of the recall data is not being shared. So previously when FDA would recall contaminated foods that have been contaminated with bird flu or with other contaminants, there would be a nationwide press release and it would be carried by media. But now that is not happening. So people really do need to follow physicians online and health communicators who are communicating public health information, who have a direct line to these FDA announcements, which don't get publicized anymore. And also they hear from local health departments where there's communication and they can get the word out. So with bird flu outbreaks and with the tuberculosis outbreak happening in Kansas and with other communicable diseases, it's important that you tune into your other lines of communication. So before we were really relying on the CDC and the FDA to blast these announcements, and now we can't rely on that because of things breaking down from a government communication perspective coming from the top down. So it's very important to follow us on social media and follow reliable sources of information on social media to get the word out.
Great point. Dr. Sharon, any thoughts?
I definitely agree with what Dr. Tusa says. I will actually add that there may also be information suppression in certain states. So it's actually imperative that you find physician online sources as physician educators online, or even some of the governing bodies, such as for me is American College of Obstetrics and Gynecology, whether it's for you, Dr. Tusa, is pediatrics, American College of Pediatrics. So those governing bodies that will have patient information sections also would be able to, provide you with information, because there will be information suppression also depending on what state you live in.
Very,
unfortunately.
Yeah. And in the show notes, we're going to put some links to ways that you can stay informed, some links to some important sources. So we'll do that. One more thing before we get to our special guest is those who like to cruise. I have not yet cruised, I have to be honest. Dr. Sharon, I think you're a cruiser, but we mentioned you're not?
Not really. So it's not my favorite or choice of vacationing. I have been on a few cruises, and if I had to choose, there'll be like a few cruises that I would go on, like maybe a Mediterranean or something like that. So I'm not like a big person who's just going to be cruising, every year. So yeah, because those close quarters and spreading of communicable diseases just kind of freak me out.
And that's what I have to share. So we talked about the princess before, I think, Christmas, the princess, Royal Princess, and now the Royal Caribbean. 180 passengers are sick. 180 passengers have a gastrointestinal illness, most likely norovirus, though let's be clear, the majority of cruises do not get these outbreaks. But norovirus is so important, and Dr. Sharon, I'm sure, and Dr. Tusa, I'm sure you can share that the most important thing to do is to wash these hands with water and soap.
And soap.
Not just sanitizer.
And singing the alphabet so you actually know you're...
For 20 seconds.
Yeah, you're getting through
20
those 20
seconds of scrubbing. Yeah.
Yeah,
and to dry the hands.
Not the little bit, not the 5-second rinse. Yes,
and then to dry them with disposable paper towels so that you're not communicating, using the same towel as anyone else. And then also keeping the hands moisturized is important. So after you wash your hands, you use lotion from a trusted source that isn't contaminated, because clean, dry, moisturized hands have the best chance of staying clean and not communicating pathogens. And of course, don't share food on cruises. That can communicate things, the same virus between families. And although it's very contagious. And
But how do you not share food? Because that's what happens on a cruise, right? The food is laid out.
Dr. Sharon.
In a buffet style, and you're not just sharing it with your family, you're sharing it with everyone else.
Well, hopefully you wouldn't be contaminating the
I don't like to share my food.
Yeah, it's difficult, but if someone in the family has it, sharing food with that person is a surefire way of getting it. And if also sharing drinks, sharing food, and then in addition to hand washing, the other thing that you can do is quarantine. So if a person is having vomiting, diarrhea, and is shedding virus, that is the time for them to not walk about the ship or walk about their house.
Just quarantine on a cruise ship. Okay, so that's real easy to do.
It's a tough order to stay in your stateroom, but if you're sick, you shouldn't be walking about the ship. So that's the other thing you can do. But it is hard. And I've also seen norovirus in populations that are not aboard ship. So I've actually seen it tear through families and schools as well. So if it gets out into the wild, it's also highly communicable. It's just that on a cruise ship, there's nowhere to go and you can't quarantine as easily as Dr. Keisha is just pointing out.
A couple of updates. So measles cases, this is kind of ironic. When I last spoke to everybody, measles cases were at 58 in Texas, and particularly in Gaines County. But now we are up to 100 cases. I just checked today. And it's wild to me because it went from 14 to 28, and now we're at almost 100 cases of measles. Now, mind you, there was a time when we didn't have many cases of measles, but 100% of those, except for 3. So the majority of those, let's say 100% though, to be honest, were those that were not vaccinated children. There were 3 cases that they're saying are vaccinated. However, it hasn't been confirmed if they had both doses and what other factors there are. But we're seeing that. The problem is people are not getting vaccinated. I think that in this area, 18% in Gaines County, 18% of the children are exempt in kindergarten. That's high. 18% exemption from getting vaccination. And then the rate in general of immunization has increased. Of not getting immunized has increased, which is a problem. Statewide in Texas, our exemption rate has increased from 0.76 all the way to 2.32. So go figure. And then finding this information is not as easy. However, the Medical Collective and our colleagues will be putting things out as we can. The CDC does still have data. However, the data was delayed quite a bit, as well as some of the information. There's been some studies with bird flu, too, that were delayed by a couple of weeks, but are now out. So just stay tuned. I had someone on. Hey, Cindy, how are you? I had someone on recently that in another place that was asking about this in their place, which is Rhode Island. And I suggest you just go to your state or area and put that in Google. If you use Google, and also search for that name and then put the Department of Health and Human Services or Department of Health, and it'll come up, and you should be able to find out what's going on in your area with flu as well. And we know flu cases have gone crazy. I had data out, and this data from 3 days ago has changed this fast. So we now have the number of cases have gone up to 33 million. I think last time I was talking last week, it was 24 million, 430,000 hospitalizations, and 19,000 deaths from flu. Flu's no joke. Hey, my brother's in here, Dr. Omar Davis. We'll have to get him on. He's a nephrologist and does some amazing things. So just be careful and be wary. I got it. This is the 1 year I decided not to do my immunization, and that was a mistake. So please, please, please check all those things out. We'll go into more depth the next time on some of the more things. Bird flu is still around. I know there were 2 subvariants that we were talking about, and they kind of have meshed. So originally the strain in the bird flocks is the one that made the person that passed away in Louisiana. But now the strain that was also in the cattle herd has also caused a hospitalization. So we're up to 4 hospitalizations from bird flu. Some of them did have comorbidities, which means other chronic diseases, underlying health diseases that may have attributed to that. In addition to that, they're now seeing the flock strain also in some dairy cattle in Arizona and Nevada. So it's a lot, and I would just say to stay abreast on the information. There is more coming out. Like I mentioned, the studies that we're seeing, some veterinarian that actually do take care of cattle, 3 of them have tested positive for antibodies. So your immune system revs up, gets ready for stuff, and what it does is you can track the antibodies sometimes, especially when you're getting exposed to something. So that's just letting us know that we're not going to see symptoms in everybody. And then the question has been, should we test? And as a pathologist, I always say test. And you have home tests. You have the flu test, which you still can get from covidtest.gov, but you also have the combined test, which is a combination of flu A, B, and COVID-19 over the counter. I also found out for our veterans, shout out to the veterans, that Walgreens has a program that allows some veterans to get free testing. That includes the combination test, and also those who are uninsured. So if you go to the Walgreens site, it'll ask you some information. And I have a video. It's like on all my platforms. You can see it, and it'll explain to you how to get access to get the testing. If you fill everything out, you can actually be scheduled to get the combined over-the-counter test done and performed, similar to before with COVID-19. Hello, listeners. We want to remind you that you can catch The Medical Collective on all your favorite podcast platforms. That includes Apple, Spotify, and YouTube. Be sure to hit that subscribe button so that you never miss an episode. We're also on Libsyn, and you can find us on all social media platforms as The Medical Collective. Do you have thoughts or questions? Please don't hesitate to reach out. We love hearing from you. Now let's get back to the conversation. The measles has been going around. Dr. Tusa, I know you are extremely busy. I'm sure people are asking you questions all the time. Less than 3 months into 2025, Dr. Tusa. Less than 3 months. And the cases have surpassed last year's total for the whole year. As of Friday, it's 300 plus cases, 320 reported across 16 states. And of course, we know the brunt of them are here in Texas, where we are, in the
260.
Southwest. Yeah, Southwest. And another 35 reported in New Mexico. So far, 2 deaths, 1 child in Texas that was 6, and then we have an adult in New Mexico that's passed away. Then we just heard about an infant that traveled internationally here in Houston, Texas now, that has the measles. And then we also heard about the pregnant persons at the time that was laboring that found out B positive and then possibly exposed many people in that area. So what are your thoughts, Dr. Atusa?
Yeah, so the fact that this is going so out of control highlights our vulnerability because of our low vaccination rate. And measles relies on the control of measles relies on herd immunity, which means that more than 85% of people have to be vaccinated for us to really be able to nip a measles outbreak in the bud. The problem is that we can't vaccinate young infants, or we did in the past, but the vaccine often doesn't take, which is why we started vaccinating them at around a year of age. We found that the live virus vaccines work better in the older infants and early toddler years. And so in outbreaks, when a child is at risk, we will sometimes vaccinate at as young as 6 months old or even 9 months old. But we can't rely upon those vaccines. A lot of times, either it doesn't lead to long-term immunity or it doesn't work at all. So the most important thing is to keep everyone around that child measles vaccinated, and that's called cocooning. And we know the most recent case in Houston was an infant. I don't know the details of how old that infant was, but if she is less than 1 year old, then she wouldn't have even been eligible for the measles vaccine. So we found out through decades of using the measles vaccine at the U.S. and abroad that the optimum time of immunization for best immunity and for the vaccine to actually work is around 1 year old to 15 months old, with a booster at around 4. And that's what the current vaccine guidelines say. However, in cases of outbreaks, such as we're having right now, even if your child is not 4 years old and they had their measles vaccine at 1 year old or 15 months, you can vaccinate them early, because the only requirement is that 28 days have passed between the last measles vaccine and the second one. And we know that once people get 2 doses, their vaccine immunity rates are above 95%. So with one vaccine, we get 85% or more of children immunized. But with 2 vaccines, it goes up to 95%. So that's why the booster dose is important. And we are seeing people who are not immune who were vaccinated. And people ask me why that is. So the most common blood test I'm being requested in my practice right now is measles immunity titer, which is immunoglobulin. And even though immunoglobulin is helpful, the main way that measles vaccines work is by priming T cell function, which is a different aspect
similar
of immunity.
to COVID.
Exactly. Mm-hmm. So the most important thing is that the cells of the immune system know how to fight. The most important thing is not actually the level of your immunoglobulin. But if immunoglobulin is low, we take that as a surrogate marker, which goes along with lower T cell immunity. It doesn't always correlate with that, but sometimes it does. Because T cells, while they become aware and they directly fight measles, and they send what's called killer T cells to kill the virus, they additionally go to these cells and they promote immunoglobulin formation through a helper T cell function. So all of that is fancy immunoglobulin terminology for if you don't have immunoglobulin, we're worried that your cells also don't know how to fight measles, how to recognize it and how to fight it, which is why the vaccine, extra vaccine dose is good in those people. And I have now, in the past month, vaccinated 4 teenagers who had low immunoglobulin titers, even though they'd had fully vaccinated toddler years. So they'd gotten at 1 and 4 years old. And their parents asked me, why isn't he immune? Did she not make immunity or keep immunity? And there's a couple of reasons that has happened. In all of these cases, it was sort of a sickly child. They were in and out of the hospital. They had multiple infections. And at the time of vaccination, it might be that their immune system was fighting other things and did not form a good immune response because it was simply overwhelmed and distracted. So this is why we don't usually vaccinate if someone has an active infection or an active fever. And so it's possible that that was the reason, and that their illnesses in their childhood led to a temporary immunodeficiency or failure of the immune system to respond. But I'm seeing great responses in all these kids. So at the teenage in the teenage years when I'm vaccinating them, I'm doing follow-up blood tests and showing that they're becoming immune, and even their T cell function improves. So who needs to be vaccinated? So infants above 1 year of age, so 1-year-old toddlers, and up to that 4-year-old age group, they need 2 doses. Okay. Anyone that there's a doubt because they were either a sickly child can get tested. Adults who are elderly adults, especially those who are above 70 years old, they likely had the measles vaccine that was given before 1968, which it will not necessarily fight the modern measles strain. So that was one of the things. So and then a lot of the elderly people, they didn't get the measles vaccine. For instance, my parents didn't get it because they had measles as infants. So they were both born in the late 40s. They had measles as infants. So when the measles vaccines came out in the 1950s and 60s, if you had a childhood history of measles, you were not given the measles vaccine because it was in short supply. So it was being given to people who'd never had natural measles. So my parents never got vaccinated. So they went to get vaccinated this week, because we also know that even if you had decent immunity from natural infection or from vaccination, that immunity fades after about 40 years. Wow. So I'm testing people in their 50s and 60s as well who had measles vaccine as children. And I'm finding, actually, fortunately, that most of them still have immunity, but I found a few that did not. So that's like the bird's eye view, as well as like the individual person view, to answer the question of whether I need another measles vaccine.
Well, here's another question, Dr. Atusa. Mm-hmm. So you say, yes, they need it. People are asking that need to get another one. Is it going to be covered by insurance?
It is. So I had a diabetic patient who was going on an international trip call me recently and say, should I get the measles vaccine? And I said, honestly, I don't know your titer. She's 50 years old. I don't know your titer. I don't know if you're immune. And she was like, well, would it hurt for me to just get another MMR? And I said, no, it doesn't hurt. So she actually went and got it before her trip. She did just fine with it, and insurance completely covered it. She just went to the pharmacy and got it.
Oh, wow. That's good.
Yeah, she has private insurance. I don't know what the policy is with Medicaid, but I know with private insurance and with Medicare, it's going to be covered.
And we want to delve into a couple of updates, okay? 2 of them is because of the FDA and difficulty getting access to information. Sometimes people don't hear about recalls as swiftly as they should. And 2 of them I wanted to share was about the nationwide eye drop recall over sterility issues. Mainly, basically, there is a protocol that's supposed to be followed, and because there was a breach of that, there is a concern about sterility of these eye drops. And it's the AvCare. I don't know if you heard of the AvCare with a K. Between 2023 up until now, the artificial tears, the carboxymethylcellulose, and another one, a lubricant eye drops, and an alcohol one.
Several types of.
Mm-hmm. Sorry. Yeah. So any thoughts on that one? And then another outbreak, just to put them together, is on food. And this is, I don't do ready-to-eat chicken. I don't eat chicken, but this ready-to-eat chicken products that now have a listeria outbreak. Now, sometimes recalls are caught early, like the eye drops, right? Unfortunately, when there's an outbreak, then you catch it. And in the case of the chicken, and over 10 hospitalizations with this Fresh and Ready Foods LLC outbreak from California to Nevada to Washington. Anything about outbreaks quickly? Any thoughts?
Grow your own. Stop eating other people's chicken. Get your own chicken. In fact, stop eating chicken.
That part, right?
Right? It is a risk with bird flu and everything else. But I would just say that just because something is labeled as ready to eat doesn't mean that it shouldn't be well washed and cleaned and reheated correctly. So I think some people eat ready-to-eat things directly out of the container and don't do that. But I got to say, it's at least reassuring that food recalls are happening, because if they weren't, then I would think that it was because of the 1,000 employees fired from the FDA's food safety program, and that we aren't actually we're only catching like the tip of the iceberg of recalls. I still believe that. I still feel like we're catching the tip of the iceberg of contaminations when there is enough human illness to prompt the investigation, which is what happened this time. And I think it was local health departments that investigated and figured it out.
I would say ready to eat don't mean you got to eat it. I would say don't eat that stuff, right? Oh, my goodness. We want everything fast and in a hurry. And anything fast and in a hurry is usually not quite satisfying. So I would be very careful.
Touche, Dr. Leslie. I agree. Dr. Sharon?
Yes, I agree with Dr. Leslie. You know, one of the things that's concerning to me is the eye care product recall.
I know.
I don't necessarily use eye drops. However, I mean, I do use contact lens, which means I use cleaning solution, right? So to me, if an eye drop can be contaminated on recall, then that can easily happen to the cleansing solution that I use to, for my lens. So that is definitely concerning to me. But at least it's recalled and it will be off the shelves. So
very true.
I use, that's a good thing.
I use artificial tears daily. In fact,
it's not that brand, is it, Dr. Leslie?
No, ma'am.
Oh, okay.
No, ma'am. I've never even heard of AvCare, thankfully. So, I mean, sheesh.
It's always.
Well, I'm recommending it always to my patients because I'm an allergist. So I recommend artificial tears for rinsing allergens out of the eye. So I've been telling my patients to avoid that brand when I'm recommending artificial tears. Normally, I don't recommend a brand, but when something like this happens, of course, I'll warn them. Just like it happened with nasal gel about a month ago, then there was contamination of nasal gel. Briefly, there was 3 months ago, actually, contamination of a Neomed nasal gel, which they caught and cleared up, and it was one batch. But I did warn my patients whenever I hear about stuff like that.
Good. There is a question in the chat on YouTube. Hello to our YouTube audience. You guys can go over to YouTube, The Medical Collective. Is the food recall app a good source? I haven't heard of the food recall app.
Never used a food recall app. What is that? There's a food recall app? I imagine that it would put legitimate things that are recalled on there, so it couldn't hurt. And if it recalled all the bad food that you've eaten, then thank God. Come on, use that
You
app.
also can go to the FDA.gov, Google FDA.gov recall, and you can be on a list, an emailer with alerts. Go ahead, Dr. Tisa.
Yeah, I was just about to say that. I don't know if that's still going to work like it always has, but I have been, as a part of my public health piece of what I do, I have been on that email list, and I used to get recalls all the time. But I've, like I said, have been getting fewer the past 4 to 6 months. But before that, for about 6 months, I had got the most I'd ever gotten. So I feel like there's a trend towards increasing contamination of both our food and medicine supply. So we have to be on alert. And if the app is probably a crowdsourcing thing, I have not used it myself, but I'll definitely check it out and see if it's run by a health department. Sometimes it's run by a state or a county health department. These kinds of things can crop up. And it doesn't mean just because it's an app that it's reputable, but it doesn't mean that it isn't either. So I think just looking into it and deciding what the source of information for that app is important.
And, just do a quick test. Look at the FDA, look at the app. Is it cooperating? Is it converging? That's a really quick and dirty way to see if the information they've got on there. But if they're telling you not to eat chicken, I'm down with it.
True. Very, very true.
Don't eat that chicken, y'all.
Someone said it's a good app, door dashing groceries. It gives notifications. And that's one last thing on this that if you do go to H-E-B's in the South or Kroger or what have you, and you're purchasing things with your shopper card, they will alert you because they know what you purchased. So it's good to make sure you're linking that when you're shopping. All right, the next quick update, you all may not know, but Dr. Leslie, I'd love to get your thoughts on this, is that it was just announced that our former President Biden had an exam, and upon examination, they found a nodule in his prostate. They have not biopsied it yet or got results back, but a nodule. And so what should people, when they hear nodule, I think people get scared, but there's more to it.
I think they need to leave Biden alone. Quite honestly, let the man be in retirement. Why are we all up in his prostate now? Why do we need to know he's not running the country? What we need to know is what the president's prostate look like. You know? Okay. So, I mean, what is a nodule? It's just a extra growth of tissue, extra tissue growth. Nodule on the prostate can be cancerous or it can be non-cancerous. The only way to know when there's an issue, you get tissue and we send it off to Dr. Keisha to look under the microscope, determine if it is in fact cancer. You can have nodules because you have an enlarged prostate, which is called BPH, benign prostatic hypertrophy. You can have nodules on your prostate if you've got prostatitis. There are certain kinds of inflammation of the prostate that would lead to, it's called a nodular prostatitis or a cystic prostatitis. So it can be that, or it could be prostate cancer. And, you know, prostate cancer comes in all flavors and forms. It doesn't mean a death sentence by any stretch of the imagination. It simply means that we need to get some tissue, determine the T stage, the end stage, whether it's expanded to, if it is found to be cancer, we need to know if it's involving the nodes, the lymph nodes, and the T stage, how far it's expanded outside of the actual prostate. But I wouldn't be worried. I mean, he's an older man, older gentleman. You know, them things don't be working so good after a certain time. So we let the president live, y'all. How many kids he's got? Yeah, he had enough children, so the prostate done did its job. Hallelujah.
Yeah, and as you get older, the risk for prostate cancer increases. But do you guys know the main modality by which we find out about prostate cancer? It's through the elevated PSA and what are called targeted biopsies. So I'm not usually seeing nodule found, here's a biopsy, that nodule. It's usually the targeted biopsies that find it, and it's microscopic. So you're not getting a 4-millimeter nodule tumor. It's usually multinodular, multiple biopsies finding cancer. Usually,
and they can do a specific MRI just for the prostate. It's a prosthetic MRI, so it gives you. It's just focused on the prostate, and you can tell a lot with that imaging too. So,
yeah,
let the man be. Yes,
and we shall see what the results are. But I'm sure everything will be fine. All right.
So I found out
updates.
who runs the food safety app. If it's still something you guys want to know, it's Reiter, REITER. It's an agricultural informatics company, Reiter affiliated companies. They have several apps. This one, they say, is designed to monitor for plagues, diseases, to help with running the ranch on a daily basis, used by agronomists to determine if pesticides are needed for dosing and appropriate fumigation. So that's what it's billed as. So I don't know if it's comprehensive, but it might contain a lot of the outbreaks to warn farmers to watch out for contaminations. So
for all of us, though, food recalls, FDA, and Food and Drug and eye drops, look for the FDA. Okay?
Yes.
Great. All right, the next one, quickly, Dr. Atusa. The FDA is moving. The FDA is busy, though limited staff. They're moving to ban ingestible fluoride supplements for children. I'm sure you've heard about this. They're initiating a process to remove prescription fluoride supplements, tablets, lozenges for children from the market because of potential health risks.
Yeah, so fluoride has been a controversial topic for a lot of years, but decades of use of fluoride have shown that it does prevent and reduce cavities, especially in areas with lower access to dental care and fluoridated toothpaste. Some people argue that there is a lack of evidence for fluoride, but the benefits of fluoridation have been proven in widespread studies. So they also claim that they can get excessive fluoride through drinking water, and they could get enough from other sources such as toothpaste and mouthwash. So that's assuming that everyone has the same level of dental care, dental hygiene, access to care. And in areas, especially with underserved communities with lack of access to dental care, fluoride has been a game changer. And we've seen this in the developing world as well as the developed world. So I think it's going to lead to a lot of tooth decay in kids and adults who don't have access to the kind of dental care and dental hygiene that we all take for granted. Maybe those of us who have more in our lives take for granted access to fluoridated toothpaste and good toothbrushes and dental visits twice a year. And a lot of people don't have that. So I think it's going to lead to more tooth decay in those populations and also down the line, more heart disease. So it's going to make the population on the whole more unhealthy because the cases of overfluoridation and thyroid suppression because of fluoride and all of these other things that are being argued are so few and far between compared to tooth decay that I think fluoride is the lesser of all evils. As a pediatrician and a public health person, I would say fluoridating the water is better. But I mean, if they wanted to do it at a lower level, but just still do it, it would still be better than not doing it at all. And this has been shown that there are some cities that don't fluoridate, and you can compare tooth decay rates in cities that don't fluoridate in the country to those that do, and you can see differences. So I think it's a move towards making the nation unhealthy, not healthy, at least as far as tooth health.
I agree. Yeah.
I would also say, when you compound that with the cuts in Medicaid and just not having access is important. SNAP benefits, healthier foods that would lead to, I'm sorry, I have a ding going on in my thingy here. I think I wasn't sure which computer it was, and I now know which computer, so I don't know how to silence that. But nevertheless, you have SNAP access, food access being limited, dental care being limited, and now you're saying, okay, we're not going to give you what has really proven to reduce the cavities. This is actually going to end up costing the U.S. money down the line. One, as a leader, one has to have foresight, right? And there seems to be a lack of foresight in the public health arena. And that's all I'll say for now. Thank you.
That's well said.
I just want to add that there are concerns over the microbiome. I'm an expert on the microbiome. I do microbiome assessment and treatment all the time. And that fluoride is actually one of the less impactful things to the microbiome than other things. And improving access to good diet for these kids by not removing SNAP programs would do an amazing job of improving their microbiome. And then I want to just give you as a corollary that not only are they trying to ban fluoride in drinking water, they're trying to ban fluoride supplements for kids, removing a key tool that dentists use to do fluoridation on the teeth of kids, and also give lozenges and other types of fluoride gels to kids who are not in fluoridated water environments. So it removes the ability to even give fluoridation in other ways to developing teeth. So I think it's, like we have been saying, it's going to cause a long-term effect, not only on the healthcare costs of this country, but on overall chronic disease and health, because tooth disease leads to heart disease and other
forget
diseases.
About the chronic care, right? Listen, if you have a daughter or a son who's trying to date later on in life, we're gonna have some issues because
you need the nice teeth.
Oh boy, oh girl,
that's what's going to get them though. Yeah,
their grill is going to be jacked up.
or the dentist, cosmetic dentistry is going to go up, up, up. Everybody's going to have dentition.
Let me get into some cosmetic dentistry. It's never too late.
Yeah.
And for those who can afford it, right?
Yeah.
Well,
For
I'll
those who can
provide
afford.
care, free of cost. Free of cost.
You will
because-
barter. Yes.
Yes, barter. We'll barter.
Well, we have one more update before we get into the art of medicine. I'm so glad we're having this episode. The FDA has approved Dr. Sharon. And when we talk about public health, and not everyone makes it in, and I already know how Dr. Sharon feels. That's why she's giving me the eye. FDA has approved the first at-home cervical cancer screening test. Now, listen, this is developed by Teal Health, and this is a
See, Dr.
collection.
Leslie?
This is a collection kit called the Teal Wand that enables women to collect samples at home and send them off. Now, number one, this is for HPV testing, right? This is not getting an evaluation. That's part of the pelvic exam. Don't forget that part. And number two, in clinical trials, over 600 participants, the test produced accurate results in 98% of the cases. The product will launch in June 2025. Hi, Dr. Sharon.
Well, hello, Dr. Keisha. So I'm just going to say that it does not replace your gynecologist, right? And, okay, sample size matters, right?
Yes.
Because you can have false positive and false negative. So you should still go see your gynecologist. I'm not really a fan of this. I think people may use it to delay you going to see a gynecologist, but just please don't let it replace you getting that annual exam from the
Wait,
gynecologist.
who said that? You too. A
First of
doctor
all-
said we cannot even get folks to take a pill. We want them to do a home path.
Right? And the thing is, too, is that, okay, part of the exam is not just collecting a sample, it's actually visually looking at the cervix. Because even if you're there for, let's say, even a pap smear HPV screening, and I see something on your cervix, I mean, that's an opportunity for me to intervene. It's an opportunity for me to say, hey, let's do a biopsy of this. Let's do this extra. Because this just does not look like it's supposed to look, So at HPV tests, okay, HPV positive, negative, okay. What's
It's a
next?
part of it. I agree with you because when we talk about cervical cancer, most of the HPV related ones we're speaking about is actually squamous cell carcinoma. But did you guys know there's another side to the cervix, which is the endocervix? And endocervical carcinoma, or AIS, which is adenocarcinoma in situ, are not picked up by these tests. And then also for those over 40, when you do a PAP and you get endometrial, what we call endometes over 40, that's not actually the screening tool, but that can be caught as well. So I do agree on that part. Dr. Leslie?
Dr. Sharon, you were so subdued. I thank God for your restraint. Is they crazy? First of all, they're reducing America already to a 6th grade level of education. And they are now asking the average American to do higher educational level stuff. Are they serious? Are they serious? Think about it. I mean, I love the convenience. I mean, me personally, I wouldn't do it. And I have skills, Dr. Sharon.
Right?
I can grab hold of a cervix, right? But I am not going to be doing that for me.
I agree, Dr. Leslie. I
it's
would
very
never do
ambitious.
that. I would never do that for myself.
Let's say this, everybody. If you can get into your physician, into your gynecologist, please, examination is key. We forgot about breast cancer. Let's not forget about that. Let's not forget about the pelvic exam, also checking the ovaries, okay? But let's appreciate the test for the necessity, but not as a replacement, all right? Not as a replacement. We shall see.
Yeah.
And again, I do agree that the test is as good as the person performing it. And we saw that with C-19, COVID-19, is that people that were performing their own test versus those clinicians, that we saw a better result, so.
But Dr. Jan, you bring up a really good point that you cannot really replace, number one, the touch, the hands-on, right? And we'll talk about the art of medicine, but the power of touch, our whole body is a living organ, right? The skin is a whole organ. And being able to visualize as well is so important. I mean, how am I going, what we're going to sell speculums now with attached mirror and light? And we're going to sell in stirrups and we're going to, what? Bathroom break? What? No. Cannot replace that touch.
No, it cannot.
You cannot. The first thing I want to talk about was former President Biden's cancer diagnosis. Now, I did not know. And last time we spoke about this, right, we said that there was upon examination, and as many people know, former President Biden is over 75, but upon examination, a nodule was found, and we knew they were going to do a biopsy. Now, what has become a problem is upon that biopsy result, there has now been the doctors that come out from TikTok and social media that are saying, oh, he knew about this. This should have been diagnosed. How does it get missed? And for those of us that are actually in medicine, this is an everyday thing. And it's actually sad because imagine if someone who has all of that ability, who is a former president, who has access to healthcare, is still getting diagnosed with metastatic disease. Imagine for those that can't. And I see this all the time when I'm going to my locums out in rural parts of Texas. So unfortunately, that's what happens. For those that are in the chat, let's see. Go ahead and chime in. It's interesting. Sometimes the technical difficulties you have when you're trying to stream by yourself, but it's okay. Hello, Zoe. Hi, Biscotti. Hello. Welcome in. Okay, so we'll get back to that. So what the news has been and what we talked about last time, check in, by the way, that episode is out. Episode 14, The Art of Medicine, The Art in Medicine is out. Amazing episode with Dr. Leslie, Dr. Sharon, and Dr. Tusa. It was so good. We spoke about the nodule, okay? And right now, there has been a lot of uproar about stage 9, stage 5, all of these things. And I think a lot of it is because people don't understand interpreting cancer diagnosis, right? And 99.999, 100% of all specific cancer diagnoses, not saying we think you have cancer, but the actual initial cancer diagnosis happens through the laboratory by a pathologist. So we know what we're doing. We're making sure it's correct as far as the diagnosis. In this case, what happens is that we get social media doctors that come out and start to purport they understand and they know. And actually, none of us know. Even as physicians, we're going on what was posted or what was reported by his team. We're not going by anything else. I don't know when his last PSA actually was, though it was purported it was in 2014. I don't know exactly what the report said because we're just going on what was reported. But I will say this, that a cancer diagnosis takes a lot of steps, okay? First, there has to be a reason or warranting for a cancer diagnosis, or it's found on screening, which is why breast, cervical, colon, and prostate, they all have screening guidelines. Now, screening can help. It's like a net. I don't fish, but I know some people, my husband claims that he used to fish, and some people fish by netting or crabbing, right? Sometimes you get stuff in the net that you don't want, okay? Those could be our false positives. Sometimes you don't get what you want in the net, and it's still out there. That's your false negative. It should be in the net. Sometimes you have to do another one, or take stuff and pick it out. So screening to me is that net. It's getting as much as it can first time. It may miss, which is why, if you listen to the episode on Art of Medicine, why it takes a physician to understand the full body to make the correct diagnosis and do the right plan. But it still can catch a lot of things if you follow the screening guidelines. Now, what are we finding out? More people are getting cancer earlier. And as you age, you also have an increased risk of getting cancer. So why is it that we are not screening people all the way up to 80 or 90? So there is a balance. If you even know with immunizations, even though they're being put into media in a negative light, there's always a risk to benefit ratio. There are some people that maybe for their benefit, they shouldn't have it. But you have to look at the risk to benefit ratio. And they believe that as you get older, it depends, that not necessarily doing the screening is advantageous. So it really depends on the person. But Dr. Leslie has said that for her and her patients, she speaks to them, and even though it's a guideline to stop doing PSA, which is your prostate specific antigen at 69, that she still may continue to do it. And you're also asking risk factors. Do you have other cancers? Do you have a family history? Do you have genetic traits that we're concerned about? So you're looking at all those things to decide if we still need to do PSA. So technically, according to the guidelines, maybe Biden was following the guidelines. And so after a certain age, they're not doing PSA. So how do you catch it, Dr. Keisha? That's where training examination comes in. The DRE, which is the digital rectal examination, not everybody's doing that. That's not something that you're going to be doing like the PSA. When I say doing that, I mean as part of the prostate cancer screening. It's the PSA is the gold standard screening. So upon examination, and that's what we talked about, was where they found a nodule. And then we talked about a nodule. A nodule can mean a lot of things. So I won't delve into the nodule because the episode before this, the Art in Medicine, we spoke about that, and it's out. You can listen to it on all platforms. So when you talk about the nodule, they biopsied the nodule. Now, if you had a PSA, which is a prostate-specific antigen, if that was elevated, that alerts them that we need to investigate further. However, it could be inflammatory conditions can elevate the prostate-specific antigen, and BPH can as well, which is benign prostatic hyperplasia. So what these amazing urologists do is they go in, use imaging, and they'll do imaging-guided biopsies. Now, with the breast, when there is a breast lesion, I usually get a couple of cores from, like, if there's one breast lesion from 3 o'clock, I get a couple cores. The prostate's not like that because prostate cancer tends to be multifocal. I'm going to take this. It's shaped like kind of like a walnut, though. Okay, the prostate is very in the middle is where the hole is, right? And around it is how they call the right half, the left half, and then on each half they divide it into upper, mid, lower, and then they have transitional, mid, and lateral. So literally, what they do is take 1, 2, 3. From 12 to maybe 24 to 26 biopsies. And each one they put in a special container a separate container, because they want to know which ones are positive and which ones aren't. Because you don't have to always treat prostate cancer with prostatectomy, taking it out. You can do other types of treatment. So they'll do all these biopsies and sometimes 2 cores per area. And we're getting all of those and we're looking at each one of them. So that is now the step where they're trying to figure out, okay, is the PSA elevated? Do you see inflammation? Yeah. Do you see pre-cancer? Maybe. Or do you see cancer? And sometimes that happens. Sometimes the cancer we see can literally be 1 millimeter. And I'm talking tiny. Sometimes it can be a 1 millimeter, or it could be 1 millimeter here, 1 there. So it can be multifocal in that sense. Now, something else that can or has happened, and I've seen this with the talking, is now all of a sudden, not only are people now social media or TikTok doctors, now they are also pathologists. The 9 number is a score. I did a little video explaining this because the 9 is a score, and I said grade, but it's actually the pattern. So if we take, and I will show a picture in the actual final video for YouTube, you will see a picture of the prostate cancer, what we see in the scores. So we look at the prostate. If it looks very normal, we never go below a 3. We call it a 3. That's the pattern. If it does not look like prostate at all, it's just like sheets of cells, that's now a pattern of 5. So we take the 2 most common, and there's stipulations as well. So we take most of the time, we take the 2 most common patterns, or if there's a very high grade, we always have to include that one. So if it's 5, and then we see some 3, that's 8. If it's 5, and then we see some 4, it's 5 plus 4 equals 9. So the Gleason score, this is a histological grade that a pathologist only does, is 9. So when they took that, can you imagine to put that in a report and now the journalists are running with it? I think that confuses people. And to be honest, they should have just said a high-grade cancer, because I don't even tell people that are laymen or say, it was a score 9. I just say it was low, intermediate, or high grade. because now they've taken that number and all they know is stage, right? But it's a histological score. So that it's a histological score. That score allows us to know it's a high grade. That's what the urologist or the oncologists are going to use to decide what to do next. Now, you got the grade, and now you know what it looks like. Now what are you going to do? The next thing is you're going to go in and you're going to take the stage. The stage is how extensive is the cancer. Now, stages are determined depending on the tumor. For a breast, the stages are different than how you would stage a kidney cancer or a prostate cancer. So the stage for former President Biden was based on the fact that it had metastasized to the bone, which is not good, but actually is one of the most common things where prostate cancer goes to is bone and sometimes brain. So that automatically puts him in a stage 4. So he has high grade, Gleason score of 9, which let's just say not even deal with that because that's made the confusion. And now he has a stage of 4. Not a stage of 9, not a stage of 10, not 25. It's a stage of 4. But all of this confusion has made it into social media. And to be honest, first of all, politicized something that should not be political. And second of all, invaded the privacy of somebody going through a serious diagnosis. At the end of the day, still a human being going through a serious diagnosis, which is said prostate cancer. Yes, prostate cancer can be missed. All of these things are true. So wanted to make sure we cleared that up with prostate. But I wanted to talk about cancer in general. And again, thank you for those that are chatting it up and hello and here and on the YouTube Medical Collective page. You could be anywhere, but you're here on a fine Wednesday night speaking with me and listening to me talk about cancer. You're always welcome to chime in through chatting. You're also welcome to continue to follow, be part of these conversations. We have a Facebook group as well called Empowered Health Network that is here to help people gather and also deal with things they may be new to them during this time or understanding why we're not hearing a lot. And actually, speaking of hearing a lot, before we go on, there was an update, which was recalls. So we used to hear a lot more about outbreaks and recalls from CDC, from FDA. Those connections have been halted or kind of slowed down to almost 5 miles per hour because we don't have those people in place anymore, unfortunately. We've talked about many times the cuts. We actually had a whole episode on cuts and freezes and what that means, but it continues to happen to where we're losing a lot of valuable people and therefore information. I would say don't be scared, but be informed. And me and other people on social media will always make sure because we do always have a foot on the other side to know what's going on. But, do know that you may have to be a little bit more on the ear or alert when it comes to outbreaks or recalls. You can go to FDA or search for FDA recalls, and you can find out about which recalls are happening in your area. Or if you're going to a store and you have like the card with it, make sure you're using the card. It's really important because that way you can know when there's like an outbreak or something like that. A few of them, I don't consume milk. I stopped it, and actually for me, it's been the best thing ever. But one of them is ice cream, and it was multiple. I had to stop calling the names, you guys. The flavors, like it was Rocky Road. It was so many different flavors of ice cream, and there's been a recall with that for very good reasons, to be honest. Another one I wanted to share about was cucumbers. So vegetables too, why it's important to make sure you're cleaning and washing your vegetables. Please, anything that has a skin. What happens? Do you think you're taking the skin off right? First of all, some people do cut the cucumbers and still eat the outside. I do. But imagine if bacteria is on the outside and you use a knife, you have transferred the outside bacteria into the inside of the food. So the best thing to do is just wash it. Make sure you're washing it and cleaning it because you're not cooking cucumbers. So the only thing you can do is make sure that you are cleaning them before you consume them. And we see that. We've seen outbreaks with salad mixes, the pre-salad mixes, all of that. Again, because we don't have the FDA testing, we don't have the responses and the access to the response, we got to make sure we're vigilant because we may miss something. Let me make sure. Yeah, we may miss something that could be detrimental. So stay tuned to that. We will talk about next time. Dr. Tusa, for everybody, is an allergy immunologist, and she's big on immunizations and explaining what they mean. So please, if you can, check her out on social media on all platforms. In the meantime, I wanted to tell you that the COVID vaccine policy changes FDA has spoken about. We are on the side of definitely very concerned, but still stay vigilant. And again, if you can get your immunizations, get them. What this means for the future and access and insurance coverage is yet to be determined. However, FDA has limited COVID vaccine approval to people over 65 and plus and those with high risk. So those are the ones that are getting it. They're basically saying children, you're leaving out newborns, that special period. I'm sure Dr. Tusa is going to have a lot to say about that, but stay vigilant with these changes that they're wanting to implement. And also putting warning labels on immunizations that we already know. For those that have been following the medical collective, we'd explain vaccines, especially C19, which the mRNA technology is also used for cancer treatment, but understanding that the risks that we have seen with myocarditis are low compared to the risk of myocarditis from C19 alone. We've spoken about that, but unfortunately, we now have a politicization of science and they're misconstruing things. And now they're taking that to where they're putting this on labels on immunizations. So very concerning, should I say, very concerning. Another thing, I love Shakira, actually. I love Shakira. I love multicultural music. And unfortunately, I knew this was going to happen. I'm going to tell y'all, when I go places, I'm masking up or I'm making sure that I have my armor on, which is my immunizations, my health, all of those things. The Shakira concert had a measles outbreak, and we already knew this was going to happen. We're over 1,100 cases of measles in the United States, and now it's at the Shakira concert in New Jersey. For those that went, I don't know who's in New Jersey. There was a rise of cases, and I think that there was exposure at this concert, so they're speaking about it. So stay tuned. They do contact tracing, if you were there. Stay vigilant as well. You can necessarily not have all the lesions out and still be infectious. And we know that. We know that one person with measles can infect 12 plus people. The R0 score, which is the rate of infectivity, is high. And that we've had up to a 20% hospitalization rate from measles. So please be careful, everybody. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.